How can I solve my depression problems? Answer: information, and you can find it here. There's a natural remedy for almost any common health ailment or condition. It's never too late to learn how to get healthy.
Signs and symptoms of depression and natural treatment for depression. What is depression? Anyone can feel down from time to time or experience bouts of emotional grief or sadness due to some unexpected life event. For instance, they grieve when someone dies, or feel the sadness and loss when a close relationship ends, or even lose a job.
All these feelings are normal and are part of the ups and downs of life. But clinical depression is more than just the blues, more than the expected grief after any loss, and most certainly more than a bad couple of days.
Depression is a deep and dark state, a black hole that may seem impossible to emerge from, and a serious medical condition involving a delicate balance of brain chemicals. Unlike a bad mood that you can simply snap out of, depression can severely disrupt the ability to function properly and can extend through every aspect of your life with serious consequences.
Signs of depression may include feeling somewhat flat, tired and unmotivated. As it progresses, a person with depression may no longer want to participate in social activities or hobbies that they once enjoyed.
Eventually, individuals with depression may even lose the drive to work altogether, their relationships become strained and they push people away and become unreachable, and the will to live a happy, productive life slowly fades. Although the future for someone suffering with depression may look bleak, there is a light at the end of the tunnel. Depression is treatable and those suffering can live a happy, normal life.
Diagnosing depression. If you suspect you are suffering from depression, make an appointment to see a psychologist or your family doctor. You will be asked for a detailed description of your symptoms, how long you have had them and how this is affecting your daily life.
A medical check is advised as signs of depression may be similar to other medical conditions such as hypothyroidism or Cushing's disease. If your first appointment was with your medical doctor, you may be referred to a mental health practitioner who will be able to further assess the situation and inform you of your treatment options. What causes depression? Causes of depression include
genetics. Genetic disposition is one of the leading causes of depression. Studies have shown that people who have relatives with a history of depression are 2 to 3 times more likely to develop depression themselves. There is also a strong genetic link between depression, anxiety and panic disorder.
Brain chemistry. Neurotransmitters such as serotonin and certain hormones such as the stress hormone cortisol have been related to depression. Depression often occurs when the delicate balance of these brain chemicals is disturbed, resulting in a general imbalance in other neurotransmitters. Stressful life events. As mentioned above, the stress hormone cortisol is particularly related to the neurotransmitters involved in depression. A stressful life event such as loss of job, a loved one, marital problems, or financial issues can trigger an overproduction in cortisol, resulting in depletion of serotonin and depression. People are especially at risk if they do not have the necessary social support.
Learned helplessness and cognitive styles. Is the glass half empty or half full? Depression can result if an individual is inclined to view the world in a negative light. With a pessimistic outlook on life, even the small things become major catastrophes, and the inner critic can become overbearing. These people often expect the worst and hardly ever see the positive side to a situation. They often assume the blame when things do go wrong and attribute it to self-failure. Certain experiences can also teach an individual that they have little or no control over life events and are thus helpless. These ideas are often learned and make us more vulnerable to developing depression.
Childhood trauma or poor parenting may contribute to disturbances in emotional development and vulnerability to depression in adulthood. Help for depression. Whatever the causes of depression, the condition can have serious effects on your life, therefore it is important to find a proper way to treat it. However, it's important to be properly diagnosed before pursuing any treatment methods. Oftentimes, psychiatrists and other professionals will hastily prescribe pharmaceutical medication, which can have serious side effects that have been well documented.
Therapeutic measures and lifestyle changes are just as important when it comes to treating depression, so if you decide to pursue this route, it's very important to use psychological and wellness treatment in conjunction.
However, natural remedies for depression such as homeopathic remedies can be extremely effective in combating depression, and they come with almost no risk of side effects. For more information on depression, Download our 9-page free health guide called Natural Help for Depression. You can find that download link throughout this video. It's free and a safe download.
The statements regarding these products have not been evaluated by the Food and Drug Administration. These products are not intended to diagnose, treat, cure or prevent any disease. The information on this website or in emails, videos is designed for educational purposes only. It is not intended to be a substitute for informed medical advice or care. You should not use this information to diagnose or treat any health problems or illnesses without consulting your pediatrician or family doctor. Please consult a doctor with any questions or concerns you might have regarding you or your child's condition.